And welcome back. Already this hour, we've heard from a New Jersey congressman about his concerns over the lack of oversight of the more than $2 trillion when it comes to stimulus money. We've also spoken with an ER doctor in New York City describing the conditions of some of the hardest hit areas. In this segment, the government response or lack thereof as the virus spread and Washington did not act. That happening as early, the warning signs, as last November. I want to bring in our guest, ABC News consultant John Cohen. He's former acting undersecretary at the Department of Homeland Security. Thank you for the time. I appreciate it.
Nice to be with you today.
So what I'd love to get out of this segment, John, if you could, is to give our audience a better idea of what our expectations should be of government. And I do this with the understanding that there's no such thing as a perfect response. But if you can walk us through the food chain where we mentioned in early November there were alarm bells, but then come January, it got to the White House that there was some actionable intelligence that said there's a real problem going on in China here, and it could be, quote unquote, cataclysmic. And then it gets into a presidential daily briefing. Explain, if you could, for something to get into a briefing, the levels of government, of intelligence, et cetera, that had to have a whole bunch of eyes on this. It's not some stray line. The right people had to know this was credible, right?
Yeah, that's right. For an article or for information to be contained in the presidential daily brief, not only is it something that is critically important for the president to see because it could impact the threat, the safety of Americans or America's interests abroad, but it's something that's been fully vetted. So it sounds like, from what we're hearing increasingly, is that the intelligence community began picking up troubling signs mid to late November that something may be happening in a part of China. And people have to remember that we keep a close eye on China. It's a strategic adversary. It's one of our #1 adversaries. But we also look for emerging public health crises around the globe because we want to protect our military and our government personnel who are assigned abroad, but we also want to identify emerging diseases that could impact the United States. So the fact that there was a growing public health issue in China and it was probably being talked about by Chinese government officials would put it something very high on the radar screen for the intelligence communities. By early January, the Chinese had already notified the World Health Organization. We were also receiving information through health channels, but the intelligence community included something in the president's daily brief warning him of a significant public health crisis.
John, as a professional in this field, what would give you greater pause that you have verifiable intelligence in a briefing and it's either seen and discarded as non-credible or not actionable, or that it's never even processed, that somebody can turn around? I mean, I saw Secretary Esper say, yeah, I don't know what you're talking about, basically, in a recent interview less than 2 weeks ago. What's worse, that they didn't do anything about it and they knew, or that they claimed to not know, including the president, he saw nothing of the kind? Well, what would give you more worries here going forward when you have intel that you move up to the top of the food chain and no one's doing anything with?
I mean, they both are troubling to me. I mean, when you're dealing with mitigating a threat, in order to protect this country, in order to safeguard the people of this country, a few things have to happen. One, we have to have the ability to collect intelligence about emerging threats. Secondly, you have to have the capacity to take that information and develop a plan to address the threat. And it seems like several things happened here. The warning signs were there. The intelligence community did its job. It gathered this information. HHS did its job. It was working with its colleagues abroad. We knew in early January that there was a possibility that a global pandemic was going to occur and that pandemic could impact the United States. So several things need to happen very, very quickly. One, we need to come up with a plan to restrict to the greatest degree possible that virus from being introduced into the domestic environment. You do that through screening. Second thing we should have done very quickly is make sure that state and local public health departments had the information they needed and the testing capabilities they needed so they could detect and contain local occurrences of the virus. The third thing we should have done very quickly is we should have activated FEMA back in January. FEMA should have been working with state and local officials to pre-position supplies, identify hospital issues that may exist so that we were prepared. And unfortunately, much of what I just described either never occurred or didn't occur until late March.
And the one thing, at least to me, John, that stands out is there has to be both transparency and credibility. The people have to believe, even if it's a hard truth, that you're shooting straight with them. And certain governors, and Democrats and Republicans alike, have gotten that credibility from some of the things they said. You mentioned late January. In late January, the president was interviewed, I think it was CNBC, and he was asked if he was worried about a pandemic. He said, and I'm quoting, "No, not at all, and we have it totally under control. It's one person coming in from China. We have it under control. It's going to be just fine." There's no way at the end of January that anybody, from what the briefings they were getting, thought this was going to be just fine. And then a month later, he said the Chinese were doing a terrific job with this. There's one thing with being oblivious, but you're also misleading the public and obviously state leaders who have to scramble in the void here if there's not federal leadership.
Right. So by the end of January, we knew that the virus had spread to 21 countries, and there were almost 10,000 cases. And what we also know is that through January, February, and parts of March, there really was inconsistent message coming out of the federal government. You had and an inconsistent message between what some state and local leaders were saying and what the federal government was saying. The federal government's role in dealing with catastrophic emergencies is to step in when a crisis exceeds the capacity of state and local officials. They're there to step in and bring national capabilities, whether it's equipment in the national stockpile or other support. That didn't happen till very late. The other thing that comes by the federal government stepping in with a cohesive national plan to deal with this type of national crisis, and I think that if we would have had a cohesive national plan back in January or even early February, you wouldn't have had as much inconsistent messaging and therefore inconsistent action across the state and local governments.
John Cohen, I really appreciate the perspective. Thank you so much.
Nice being with you again.
All right, everyone, when we come back, we will switch gears. And I want to show you how a world-famous opera singer sang to millions of people on Easter, giving them comfort during a difficult time.